Hello everyone. Myself Dr. Vinod Kaushik from IIP Digital Media team. I will host for today's webinar on holistic approach towards low back pain with the resource person Dr. Smita Shinde, being organized by our branch, Maharashtra branch. And now I will just say thanks to my IIP India Digital team and Dr. Ruchi Vaishnav and Sanjeev Jha sir for providing us this wonderful webinar for a wonderful platform for sharing this knowledge. Just I will like transfer to our moderator. Please, ma'am, continue with the webinar.
Yes, sir. Thank you, sir. Good afternoon, everyone. I, Dr. Smita Shinde, welcome you all on behalf of IIP Women's Cell. IIP Women's Cell functions under the guidance of National Head Dr. Ruchi Vaishnav and IIP President Dr. Sanjeev Jha. We have 5 zones in India with head for each zone. Dr. Pooja Kamble is the West Zone head. The state team of IIPWC Maharashtra includes state coordinator Dr. Suvarna Ganvir, joint coordinator Dr. Snehal Patel, and a sub-coordinators Dr. Uttara Mohan, Dr. Priyanka Karande, and Dr. Nirali Sangvi. We have 22 district committees in state. In Maharashtra, IIP Women's Cell has conducted many low-cost activities like CMAs, workshops, conferences, webinars, public awareness campaigns, health campaigns, blood donation camps in various districts since 2018. In the year 2019, 2020-21, 2020-22, 2020-23, and 2020-24, IIPWC Maharashtra has received awards for Best IIP Women's Cell State Team. The networking committee Maharashtra State, working under the guidance of IIPWC Maharashtra State, includes Dr. Mayura Deshmukh, Dr. Murungai Outsat, Dr. Smita Shinde, Dr. Ketki Patni, Dr. Krishma Pandey, Dr. Sakina Dilbar, and Dr. Rutvi Gandhi. World Physiotherapy Day is a global healthcare event celebrated on 8th September every year since 1996. This year, 2024, the World Physiotherapy Day theme is low back pain and the role of physiotherapy in its management and prevention. On this occasion, the IIPWC Networking Committee Maharashtra State has organized a webinar series on the topic low back pain with the most eminent speakers from different fields. Today's webinar will be addressed by our senior most faculty in the field of physiotherapy, Dr. Prajakta Nair, on holistic approach towards low back pain. And I, Dr. Smita Shinde, will be the moderator for this webinar. Before we proceed ahead, I would like to introduce our today's speaker, Dr. Prajakta, who is the owner for Dr. Prajakta, who is the owner for Indu Advanced Manual Therapy and Neurokinetic Rehab Center, with an impressive 26 years of clinical experience. Her achievements she has completed a bachelor's in 1998 from GNM Nagpur and her master's in musculoskeletal therapy from MGM Mumbai. Constantly driven with an expand of her knowledge and refine her skills, she has also prestigious certifications includes COM, that is Certified Orthopedic Manual Therapist from Curtin University, Australia, FNMT, Functional Neuromuscular Therapy from UK in 2022, NKT, that is Neurokinetic Therapy from USA in 2022, Diploma in Applied Physiotherapy Level 4 from IIAP Australia 2024. Her extensive knowledge and experience makes her a leader for her field. Hence, I welcome Dr. Prajakta ma'am, IIPWC members, networking committee members, and all the delegates who all are attending this webinar. Now, I request Dr. Prajakta Nair to please start with the enlightening session which all are waiting for. I will stop sharing my screen.
Thank you so much, Smita. I would thanks to all the IIP committee who has approved my clinical experience to present in the form of a holistic approach. And a very good afternoon to all my teachers, all my colleagues, all my friends, and all the upcoming physios. So when we consider, I'll be just sharing my screen. Just 1 minute. You all now know what exactly I'll be telling. It's the reverse way. Okay, so like for low back pain, which is of non-specific origin, we need to consider the biopsychosocial model. So this has been presented in the Pain Congress by my teacher, Peter O'Sullivan from Curtin University. So I'll be just explaining in short. So low back pain, it's ranked globally as the leading cause of disability that emerges during adolescence, and it might extend till the adulthood. For many, it might be just self-limiting, but in the maximum population, it is disabling, distressing, and it definitely negatively affects our daily lives. So chronic low back pain, which is of non-specific origin, there what exactly in this biopsychosocial model they have explained is it is a neurobiological and behavioral response from the individual to a actually or a perceived threat to their body. Thus, this disrupts their homeostasis. This response, which is far more than the actual process, is modulated by an array of changes across the neuroendocrino immune motor system. So you can know when the pain is chronic, it will include your neuro, your endocrino, your immune, and also your motor system. So it's the central sensitization. So with chronic low back pain, which is of non-specific origin, it has this biopsychosocial model. So now, because it has all the aspects, we need to consider it in a holistic way. So holistic way, how it is, like we need to consider at the physical level, okay, at the emotional level, and also at the nutritional level, so that we can reach the root cause of this pain. So I'll just give you an example. Like when we consider these types of low back pain, we have already know that acute, subacute, chronic, we give these subtitles. But when it is a non-specific origin, we need to add the emotional component and also the metaphysical component. So with just an example, the physical component, how a person who is having low back pain, even if he is doing lot of crunches and abdominals, okay, so now what exactly is the abnormal pattern which is there physically in the brain is he is holding his breath. That means he is holding his diaphragm, and then he is doing the abdominal exercises. So what will happen? The abdominal muscle, they will have low tone. So centrally it is inhibited. So we need to look at the neural connectivity at the brain when it comes to the physical aspect of non-specific low back pain. Now, emotional. I'll tell you, nowadays, 90% and above people are having emotional distress, stress, and that comes out in the form of pain. So that's the emotional. We'll be going into the depth. The nutritional one, yes, the deficiency of the micro and the macronutrients, definitely it acts in the perception of pain. It may elevate the pain perception. Now, the something different which I have written here is the metaphysical. So metaphysical, it is the energy imbalances. So that we can see with various modes in applied physiology. So I'll just give an example. A person with high liver energy, he might present with low back pain unilateral. Okay, now that high energy might be he is having lot of drugs, or he is not able to express his emotions, or he is into lot of anger, that is increasing the energy of the liver. So this is the metaphysical aspect. The other type which I have classified is a patient who requires relaxation, patients who require releases, and patient who requires activation. So now how we'll come to know? Okay, so but example I'll be giving. So now here what happened is relaxation. A lady has come to me after the marriage of her son, and she is totally exhausted, and the anxiety level is very high, and then she is complaining of low back pain. So I need to go into the detailed history of that pain. So then I understood that because of that exertion, she is in a holding position. Her parameters are all tight. Her muscles are into high guarding. So I have to give relaxation. So relaxation we can give in the form of DCAT, CST, or with magnesium also we can add that relaxation. Now I'll tell you one example of release. A lady who has stand throughout the day, okay, for some activities, and then at the end of the day she is having low back pain. So as the muscles are weak, she might have a high pelvic floor. So just a release of the pelvic floor will activate her all kinetic chain. The other this thing is activation. So I'll just give another example. A person who is sitting throughout the day for longer duration, he will have shut down his glute max. So just activation of them will activate the kinetic chain. So this is one of the type where we can see how to distinguish. Now the low back pain causes, everyone know the mechanical causes. And before that, I would like to tell you that we need to go into the depth of the pain story. So now what is the pain story? So we should know exactly what are the circumstances which has aggravated this pain. So I'll be telling you one of my client, how she was. Now you can see how she is doing exercises. So on the day one, when she came to me, she was in excruciating pain. She was not able to sit for a while. She used to lie down, and with the legs bent, she used to feel better. Since last 1 month, she was totally bedridden, and doctor had advised surgery and lots of drugs. But then when I came to know, I asked her, what was the triggering factor? What happened? Did you have a fall or something fell down or something? She said, nothing. I was on the road. My granddaughter was riding a cycle. Okay, and some life-threatening situation happened, but with God's grace, nothing happened to that small girl. Okay, but then she went into a fear mode. So fear mode will activate all guarding of the muscles. So she was not able to come out of that fear mode. Okay, so her all diaphragms, her jaw was totally tight. She was clenching. Her diaphragm was high. She was in lot of acidity. She had the stress incontinence. She had a lot of pain, and her body was into fight flight mode. So I went into relaxing her. I did a lot of DCAT for her. I went for lot of relaxation, lot of energy balancing. And you can see at the end of the first 1 month, that is the 30th day, you can see she is doing Surya Namaskar along with me. So just to know the pain story is everything in non-specific low back pain. Okay, so in the history taking, other than all those things, what important points which I would like to add up is the operative. A small operative laparoscopic operation at the appendix might shut down your abdominals. Okay, so once the abdominals are shut down, what will happen? The back extensors, they will take over, and you will have a lot of pain which you are not able to understand. So a small scar, okay, that can also ruin the kinetic chain, and the muscle can go into spasm. Okay, then any injuries, okay, you fell down, so you went into a guarding position where your pelvic floor remained high. And we'll be explaining in detail how the kinetic chain affects, how pelvic floor is affecting jaw is affecting pelvic floor, and low back in the center. Okay, then ankle injuries, yes, the ligament, if it is not treated properly, it might affect till your temporal bones. Dental procedures, intubations, so all this will cause tightness in the jaw muscles. The jaw muscles are connected to your pelvis through fascia. Okay, when the person has an intubation history, maybe just endoscopic examination, okay, that might shift the hyoid, or that might, what we can say, cause unilateral spasm. And when the hyoid is shifted to one side kinetic chain is stretched, the other kinetic side chain is contracted. So this is very important. Operative history, any type of operatives. The major portion of patients which are coming to us are the female, okay, and that to that vulnerable age, that is that puberty wala or the perimenopausal or the menopausal or post delivery. So these cases, they are very sensitive, highly susceptible, and they I'll tell you, they have a psychosomatic and psychosocial aspects of pain along with this. Okay, so we need to consider this. I'll just give example of one of my patients. She had come to me. Her son is 18 years old. Since her delivery, she is having low back pain, and she is considering that anesthesia point to be the main culprit. Okay, she came to me. I have seen her. So she was into all guarding. Okay, and the C-section scar was very active. Once I released that scar, she was better. Okay, but then still her jaw was tight. The other things were tight. So the emotional aspect, then I could found out the pain story was it was a late marriage, it was a late conceivement, and a 40 plus she was that time when she delivered. So she had little high raised BP, and the baby was low birth weight. But all those emotional stresses, they were still there in her body, and wherever you will press, it was painful. So she was into allodynia phase, where anywhere you will press, you will have pain. So that history and the pain story along with that history is very important. Now, acidity, IBS, so these are all what I will consider the emotional issues you need to ask along with the low back pain history. So these are along with that when we consider the low back pain issues. Acidity means again diaphragm issues. Bruxism again means emotional issues. So all this is a connection which I'm showing. Jaw to the pelvis connection. So you can also try when you open your jaw, try how is the pelvis goes, and when you clench your teeth, see how is the pelvis moving. Okay, so addiction. Now addiction again, smoking, tobacco chewing. Now yet theek hai because that will add to the toxicity, but more is their jaw. Constantly they are smoking, they are using the jaw muscle, tobacco chewing. So all this jaw to pelvis. So whenever a patient comes and he tells me that he's a smoker or a tobacco chewer, we release the jaw and their low back pain goes away. Okay, so this is the kinetic connections. Now, the main history which we nowadays need to take is the net addiction. Maximum of us are exposed to electromagnetic radiations, and our body is into switching mode, and all the muscles are into holding position, particularly all these people who are into this computer jobs. Now, sedentary lifestyle, then you know all the muscles are not working. If they are traveling more, then they are not relaxing. Okay, and if gym goers, I'll tell you, maximum of the gym people who are lifting weights, they have all tight fascia, all the diaphragms are very tight, and they have 1 or 2 episodes in their lifetime with low back pain. Also, sleeping pattern, yes, that will indicate the anxiety level. People are not able to sleep. So all these are the triggering factors that will add up to the low back pain. So if you are treating it with all the latest things, latest aspects, but the patient is not sleeping only in the night, they are awake on the mobile, then their muscles will be all in the guarded position. Okay, so history, this is all very important. Now, water intake, yes, that is very important because our body is made up of water more than 70%. Now, how this is related with our low back pain? Okay, now fascia, which I'll be explaining in detail, its nutrition is hydration. Okay, the muscle psoas, which when it is under guarded position, it will compress your low back and it will have all the issues in the low back. So this water, how much they are drinking, whether they are able to hold that water inside their cell, or even if they are drinking, they have to go to the washroom quite often. So all this matters a lot. I have seen many patients, just by giving them, just by hydrating them, their low back pain is gone. So the important one over here is the level of stress. The patient might not show how much they are suffering. Okay, there might be a lot of relationship issues with the in-laws, with the spouse, with the children. They won't be telling, they'll be hiding, and every time they'll be coming to you with flared pain, with recurrent episodes. So we need to address to that issue. Okay. Then if there is a previous episode of pain, then centrally the patient is already sensitized. The brain is already in a high guarded position. Now here nowadays, I would like to tell, I would like to see, I see each and every aspect. Okay, so the tattoos, I'll consider it as a surgery. Okay, it will disrupt your facial lines, it will disrupt the fascia, and the tattoos, they are considered as operatives only. So they are, we have to treat them as a scar tissue. Fears, how much they have fear about going to traveling, how much the patient, they have fear regarding their activities of daily living, how much they have the negative approach, आप कुछ भी कर लो मेरा दर्द तो ऐसे ही रहने वाला है. So all this will again add up to the negativity, add up to the muscle guarding, and at the end we are not able to go to the root cause and treat the low back pain. Metabolic issues, yes, so you all people know about that. So after this, just see after the history assessment, only one or two points which I would like to add. So now here she has low back pain, which is referring down from one side, and just see her how she is walking. So that should indicate us where we need to work. She has issue with her low back pain, okay? But then if you see, she is walking on her QLs, on the quadratus lumborums. Her glutes are totally shut down. Now, why they are shut down? Okay, obesity is one of the reasons, but many people are obese. They don't have low back pain. Okay, so you can see there is a edema and swelling in the ankle, and she is not having that push off phase. So it's the ankle tightness. She is not able to do that push off. And at the end of the push off, there is activation to the glutes. So because of that, push off absent, her glutes are not working, so she is waddling and working with her QL. So QL, when compensating, have a unilateral pain. So this is like through assessment we can come to know. Now basically like now in the previous one, the cause was a stiff ankle. Okay, now here we'll consider, just see the she again has low back pain, okay, since 25 years, and I had just asked to lift her head, and you can see the amount of diastasis of the recti. So when the patient is not able to increase the intra-abdominal pressure with proper techniques, what will happen? They will have low back pain. Now here you can see how much the issue is there. Okay, so these few aspects we need to consider when we are having the holistic management. Just don't look at the investigations. Okay, and we need to see overall how the patient is presenting the complaints. Okay, now this we are with we have already eradicated any red flags. Okay, so this is a non-specific low back pain management, that is a holistic approach. So physical management we'll be covering the emotional and also the nutritional management. So physical management, yes, exercises, they need to have lot of exercises. Brain will understand only and only movement. So when you want to remove that pain tag, when you want to erase that pain memory, you need to move. When new movements, new neuronal activity, new synaptic connections, and this will help to rewire the brain in a proper way. Now, because of central sensitization, there is all short circuit which is happening, and the patient is into high guarding. Okay, so exercises other than helping us at the central level, locally, definitely weight bearing will help to prevent osteoporosis and the sarcopenia. So like now you can see a person who is exercising, they have a good muscle mass, and here the muscle mass is less. Once you are 35 plus, sarcopenia starts, and it's reversible. Yes, when you lift weight, when you do weight bearing, it is reversible. So our aim as a movement specialist should be that we should be able to treat the patient's pain and also increase their functional ability. They should be able to lift weight. They should be able to do all those things properly. So this is the with exercises. Now, the second, in the physical, we will be looking about the facial system. So fascia, you can see this is a courtesy from the anatomy trains. This is a normal fascia. You can see it's quite hydrated, quite pliable, and it's very good in texture. Okay, now the picture down here, you can see it's all kinked, it's all tight. The nerve, you can see, okay, it is tight, and the artery is also tight. So the fascia itself, that might start giving pain. Okay, so fascia, it's an organ of form, and it is continuous interconnected web. Fascia holds the cells and tissues together and also keep them separated. So now with respect to low back pain, which fascia we need to see? We need to see the thoracodorsal fascia. Yes. So this fascia is having lot of free nerve endings. Okay. And when the glutes are weak, okay, the posture is bad, what will happen? How the patient is walking? Previously, you have seen that lady, she was walking on QL and on her thoracodorsal fascia. So when that fascia is very tight, what will happen? She will have excruciating pain in her low back pain. Okay. So the fascia, it is the richest sensory organ. It has highest amount of free nerve endings and lot of proprioceptive receptors. When it is healthy, you have seen it is unrestricted and there is a sliding, gliding movement. Everything is proper. But now the patients which are coming to me, okay, so their fascia is unhealthy. There are facial adhesions, immobility, and inflammations. So now the fascia, is it under voluntary control? No. So it's under the control of your autonomic nervous system. So when you are stressed, you're sympathetically high, what will happen? And also over that you are dehydrated, what will happen? The fascia will be into a holding position. Okay. So constriction of the fascia, constriction of the nerves, constriction of the arteries, we can see over here. Okay. So now this will lead to more perception of pain, more peripheral nociception. So this is the peripheral nociception which we can see. Now what it will happen, the patient will have a wrong belief, I won't bend, this is painful, I won't move, I'll be like that. So all these movements he will restrict. Now what will happen with restriction? Again the facial mobility will get lost. So again the nociception peripheral will increase. So when this vicious circle of non-movement, stress, negative thoughts, negative beliefs, what will happen? There will be at the end central sensitization. And now the patient won't bend, won't sit, won't do any activities of his daily living, and the pain cycle continues. So we as a movement therapists, we need to break this vicious cycle. So just in short, I'll be explaining these facial lines. So this is a superficial front line. So it starts from your toes, you can see, and end at the scalp level. So the dysfunction with this chain is you will have limitation of plantar flexion. Okay, and basically with respect to your low back pain, the pelvis will be anteriorly tilted. Breathing will be restricted. So now what we'll consider that diastasis recti case. Okay, so in her case, completely here there was an issue. Okay, so why that the issue was there? Because her diastasis is here, her origin and insertion went into tightness as there was an anterior pelvic tilt. So now this will pull her rib cage down. The costal angle, which has to be 80 degrees, will be obtuse. So the dome of the diaphragm will be flat. So there will be less excursion of the diaphragm that will prevent the increase in the abdominal pressure while lifting or doing activities of daily living. So what will happen? And at the end, the superficial backline will take over. And when the superficial backline will take over, what will happen? The erectors, see, they will be working more. Okay, in the anterior posterior sagittal plane, they will be working more. So when we see from the side, during assessment, we'll come to know which facial line is working more and where we have to work. So these two lines, they will help you to have a anterior posterior balance. Now the lateral line. So here comes that ankle sprain wala thing. Then few people, they have injections, lot of injections, so their glutes are gone. Okay. Few people, they have issues unilaterally. So here, this is the lateral chain which is affected. We need to see how is the ankle position. Okay, how is the pelvis on one side? So the coronal plane activity, the patient, her back line was affected because front line was affected. So she was totally on her lateral line. And then more and more compression at the facets, and then the referred pain was coming. Okay, but that issue was her ankle that time. So there's lateral chain. Now the with respect to low back pain, so the history which I had went into detail, okay, you can see this deep front line. So what is the major role of this? It supports your body. Okay, so this deep front line chain, okay, its main role, it stabilizes the each segment of the leg, your hips, and it also supports your low back, your lumbar region. Okay, and it helps in shaping your abdominopelvic balloon. Okay, and it also helps to for the chest for inhalation and exhalation. Now you tell me, people who have constant chewing habit, okay, chewing gum, then tobacco or smoking, they have all tight jaws. So now this kinetic chain, it might affect here. This is the source. So releasing one muscle will release this, right? Now the second one, ankle. People have supinated one side pronated feet. So when this is working more, the tibialis posterior, your pelvic floor is working more. So pelvic floor, the muscle is obturator internus. This muscle helps to have a normal pelvis. Okay, a new normal, not in anterior tail or on a posterior tail. So when it is at a mechanical disadvantage, your spine will be anterior tilted, and then you will have low back pain. So we need to consider all these chains. The spiral line also, you can see all this, the obliques and all. So here I'm giving a facial release. You can see this is the superficial backline fascia where I'm mobilizing it. Now, and this one, it is a superficial front line, which I am mobilizing. Okay, so this is another a physical aspect of treatment for the low back pain, okay, which is of non-specific origin and a chronic one. Now the scar. Now scar you can treat in any ways. Okay, my favorite is neurokinetic therapy. Okay, so scar, it carries the maximum weightage. It has all distortion effect on your fascia, facial lines, and there is a lot of compensatory patterns which the patient develop. And when the patient is not able to sustain, the patient broke in the form of pain. Okay, so now with respect to low back pain, a C-section scar or any abdominal surgery scar. Now see how it is all distorted. The fascia is all distorted. Okay, so now we can mobilize that with cups or needling. Okay, scar rehab. So I have preferred neurokinetic therapy. You can just see this video. Surgery scar, the hysterectomy scar, and this one is appendix scar. So now you can see the tone in the muscles. It's very less. We'll just test the transversus abdominis. So we have to take a certain muscle, a global muscle, to see how we have improved by desensitizing the scar. So in her case, it is totally WIC. The transversus abdominis is 0. Now I'll be through the muscle, anterior deltoid. I'll be checking 2 points. Okay, I'll be checking 2 points on the scar. Okay, and I'll be, one point will be facilitated, the other will be inhibited. So I'll be mobilizing the, I'll be releasing that facilitated point and activated the point which is inhibited. Okay, so now this is a manual technique, neurokinetic therapy. It is an advanced technique where the dysfunctional pattern we correct at the brain level. Okay, so we at the end we will again rewire that transversus abdominis to the brain. So since that operation, that muscle has shut down and she is having low back pain. So the definitely we have a neural edge where we train that muscle to that level, but after NKT, the neuronal activity has again reached. So now you can see again I am testing after releasing. Now this is releasing the scar. So we have to see the direction of the scar release also. So that can be done with this advanced neurokinetic technique. And I am just showing how it is getting mobilized. So anyway, any kind of treatment for that scar you can take. I have chosen a manual technique. Okay. And you can see after this, previously the transverse abdominis was totally WIC. That means it was weak in clear. So after this, you
पैर नीचे रखो, पैर नीचे रख लो, हाँ? फिर नीचे हो गया आंटी, आप जितना हो कोशिश करो पैर बढ़ने की। कभी नॉर्मल ब्रीदिंग करो, हाँ। कभी सांस लो, छोड़ दो, पेट अंदर रखो, पैर नहीं पकड़
now
के
see the
रखो।
neural contact. Okay, so the neural activity we have activated. So with neurokinetic therapy, we can balance the scar, we can balance the muscles. I also, with respect to low back pain, I manages the ligaments. Yes, I'll tell you, this is awesome technique. Now, just example, I'll be giving a patient with increased lordosis. Okay, anteriorly tilted. So along with those lower cross syndrome and everything, okay, what important thing we have to see into the ligaments, they are the extension of the fascia. Okay, so again we are at the fascia level. So here when the lordotic posture is there, the inguinal anterior the inguinal ligaments, you can see here, they are facilitated, and the iliolumbar ligament, that is inhibited. Okay, so here I'll be balancing it by NKT. So this is also one of the technique. So physical is done. Now we'll be into the emotional aspect. So everyone laughs, "Arey, kya emotions," and all those. We are working so hard. We are having lot of exercises. Why my pain is emotional? So here I'll tell you, because we are humans, we are emotional. Okay. So emotions, they are the result of some chemicals which are released in the brain. These chemicals causes organs to respond by creating their chemicals into the bloodstreams. So our emotions, through the language of this biochemistry, it travels in our body. And when these emotions are imbalanced, you will have issues with your energies. Okay. We as a human, we have stress at every level. And I'll tell you, because of all these Wi-Fi's and because of the maybe workload or maybe performance pressure, we are into a lot of stress. Now, stress is holded in the muscles. So with applied physiology, we can calculate this stress. We can know that where exactly the stress is, which organ is affected, which each organ has a muscle. So if you have, now I'll just give with respect to low back pain, kidney meridian is affected, the muscle is psoas. Okay, psoas, the emotion is fear. Fear of lifting, fear of losing people, fear of pain will again high guard that muscle. Okay, so when we balance the energies, the fear, when we balance, everything gets balanced. Okay, so this is the emotional aspect. Now just see this video. Okay, how these are all the meridians. There are yin and yang meridians. Now this applied physiology, it is based on the kinesiology and a mixture of traditional Chinese medicine. So here there are yin and yang, you all people know. Okay, and the meridians, they flow, they have a energy flow throughout them, that is called as a qi in traditional Chinese medicine. And throughout the day, when we eat, there will be high energy in the stomach. Okay, when we exert too much, there will be a low energy in the kidney. So ये सब energy imbalances होते रहता है. But when this remains for longer period, what will happen? The dysfunction will start, starting from your energy dysfunction. When that energy dysfunction remains for longer period, it affects your muscles, it affects your fascia. You have seen how ANS is affecting fascia. Fascia is affected, myofascia is affected. Yes, the muscles, they hold that emotion, they hold the stress, they are affected. So at the end, anatomically, people get affected. Okay, so this is like the applied physiology base. In short, there are various modes also. Now one of the mode here is the electromagnetic radiation mode. Now here you can see each membrane has one single potential. Now this person is wearing a watch with Bluetooth wala watch, where he can read his heart rate and he can talk. So now I have checking, when he is wearing that, you have seen that deltoid, that has the strength is low. Now after again, I'll just repeat, just see the strength in the muscle. He's not able to, he's such a good build person, but light pressure of testing, he was not able to hold. So I have asked him to remove that And now see again the strength. So electromagnetic radiation, this affects our body. Now you just imagine हमारे यहाँ everywhere there are towers, Wi-Fi दिन रात चलते रहता है. So what this will do? This will add up to the positive charges. Okay, we are magnetic. That's why we are on Earth. Our Earth is a big magnet. So when we are charged, we are positively charged. What will happen? The muscles will undergo guarding. I'll tell you, just removing the electromagnetic radiation with applied physiology, the patient pains just go away. Now, when the patients are into electromagnetic radiation, their water holding capacity also reduces. So they are dehydrated. So dehydrate ho gaya to kya hoga? The fascia will be dried up. Okay, the main nutrition of the fascia is your water. And wo dried ho gaya, and your sauce. Sauce has also water. So ये water जब when it is not staying in your body constantly, you are going for the washroom, you will have low back pain. Okay. So these are the various modes or mudras through which, additional to these modes, we will be doing certain muscle testings so that the patient's body will talk to us whether they require hydration or they require electromagnetic radiation correction or there is an energy imbalance, and through various alarm points we can know exactly which organ is affected. Okay, so now this is the dehydration. Just by I am just pulling her hair, the muscle goes down. So that indicates that she is dehydrated. Okay, so various modes I'll be doing with my hands, and then I'll be touching all the alarm points. Okay, so these alarm points will tell me that where exactly that water, which organ requires water. So these are the GV, CV, lung points, liver, gallbladder, spleen, kidneys. So this is how we will be just activating energetically. Okay, this is energetically we are activating, and the patient has to drink water. So even if with this short correction, what will happen? The hydration level will improve. And yes, you have to see the electromagnetic radiation correction also along with this. Okay, so after this, these are all various steps, okay, in applied physiology. So energy balancing. So this is like, as previously I have told you, these are the yin meridians, these are the yang meridians. Now, with respect to low back pain, I'll give an example. Okay, sometimes people are born with low kidney meridian energy. Kidneys are normal functionally, all everything physiologically is normal, but energy wise, थकान रहता है, थोड़ा थोड़ा हो गया, सो जाते हैं. So that might be the reason, or the person is standing too much. पूरा दिन standing. So this affects the kidney energy levels. Okay. So now what will happen? ये lower energy हो गया, so it will draw energy from liver, it will draw energy from heart, pericardium. So at the end, ये कैसे करके he will have its requirement जो मिल रहा है, it will be okay. But this will be again scarcity of energy. So the muscle will be into guarding position. कौन सा? Psoas. Okay. So this is energetically. Now, if adding to this, they have fear, they are dehydrated, they are into electromagnetic radiation, क्या होगा? Severe episode of low back pain. Severe episode of low back pain. Okay. So we can manage these energies with applied physiology. So that's a very good technique. Now there's another one. This is the ear hologram. So you can see various organs. They are represented in our ear, right side, left side. They are a little different. Okay. So now what happens is this is a Tai Chi. So when there is energy disturbance, we calculate the coordinates and accordingly we just activate those energetic points so that the organ will start having its normal functioning. Now you can see here the sound modes. Sound is the best healer. I'll tell you, it heals your soul. The stress which is holding in the bones, that can also get healed. So these are all tuning forks from Australia. They are according to the meridians. They have particular frequencies. And when we hear, automatically our brain calms down. Okay, so this is again the sound healing. Now you can say this is the essential oil. So essential oil, I'll tell you, Essential oils, we again we have a hologram and we take out the coordinates and then we give that to the patient. The patient has to smell. So what will happen? The olfactory lobe will get activated. Now reflexly, this olfactory lobe, it will reduce the stress. It will deactivate the stress centers located where they are located at the hippocampus. They are located in the prefrontal cortex in the amygdala. So reflexly, it will calm down your emotions. So now this is again one of the more flower essence. So in applied physiology, we have backflower, we have Australian bush, we have desert alchemy, and each flower essence has the same vibration as that of the flower. And they are like distilled and they are packed in water and they are diluted. So with the meridians which comes, okay, we will be applying it at the navel or at the forehead or maybe just sublingually we'll be giving one drop. So flower essence, it causes a shift, okay, in our abnormal stress thinking pattern. And this all happens at the subconscious level. All researches are done. These essences, they have the vibration imprint of the flowers, okay? So these are the healing vibrational modalities and remedies. Now, this also, along with the flower essence, the attitude of the flower will be added to your subconscious level. Okay, so it helps to transfer the specific attitude, thoughts, and feelings which are related with the harmony. So this is also one of the healing modality. Now here the structural AP, yeah. So structural again through this is the highest amount of this thing. Lot of procedures are required to reach to this level. So in her case, it was her pericardium which was running high, and because she had a lot of trauma, she fell down. She was a great dancer. She was not able to go again to that dancing level. Okay, so there was a sadness associated with that, and she had along with that low back pain, and her knees were also giving away. So it was like through calculation came out to be her pericardium to lungs, and the various steps are there where we have to mobilize the various bones in the skull. That's why we mobilize the dura. Okay, so dura is tight. So see the helix, it's all tight down. She's having pain down. So we are unwinding the dura on the top. So automatically यहाँ नीचे का जो है वो unwind हो जाएगा. So this is the awesome technique. I'll tell you the results are too good. Okay, so now just listen to this.
For attitude, and now choose to kindly, gently, lovingly and supportively, transmute, transform, transcend, dissolve, my indefiniteness,
Listen.
my investigation, my fluctuating mood.
So all the abnormal pattern of behavior, okay, that we are making her aware, okay, and the sound is also going on. So we are making her aware all her wrong pattern of thinkings. Okay, so now how she need to change? Yeah. So make the decisions from the perspective of all encompassing love. So yes. So just listen to this.
Opposites.
So this attitude along with the tuning fork, that will go into the subconscious level, and that will rewire her wrong pattern of thinking, her wrong thoughts. And you always know that a wrong thought, I'll tell you from my clinical experience, a wrong pattern of thought, ek bhi thought aaya that, oh, whether I'll be able to reach there or not, the muscle goes into tightness. So this will help to reshape her behavioral patterns. Okay, and then she has to the attitude, always it comes like after a long procedure, and the attitude exactly matches with your behavioral pattern, and she has to read it for almost consequent 21 days, so that her thinking pattern, her behavior pattern will be normalized. Okay, so the emotional aspect is done. Nutrition, you everyone knows ye sab chahiye, vitamin D, omega C, D, B12, iodine. But the most important, I am very thankful to my sir, Vardhaman sir. He has done a lot of researches, and this magnesium, I'll tell you, this helps in relaxation of your muscles, of your body of your brain, and it helps in reducing the inflammation. It helps in reducing the cramps, reduces the stress. Okay, so this is awesome technique. We use quite often in our clinic with this. So in now you will see only one session of structural AP. See the shift, and this was maintained. ऐसा नहीं कि ये चले गया. This was maintained one day, and look at her, that girl. Look at this. So this is like we could achieve, okay, through applied physiology. So in at the end, in short, what I'll say that everything affects everything. If the patient is not improving, we need to go into the depths of that pain story. We need to go into the depths of their relationship. We need to go into the depths of their thinking pattern, of their behavior pattern, everything. Okay, so management of non-specific low back pain, we have to see the biopsychosocial model. Okay, we have to cover all these aspects. So as a movement therapist, we want the patient to be actively participating in our ट्रीटमेंट. ऐसा नहीं कि पैसिव ही हम सब कर दो. सो पैसिव हो गया तो द ब्रेन मेमोरी जो पेन का है दैट वोंट गो. सो एज अ हेल्थ केयर प्रैक्टिशनर we need to see beyond the structures which are affected. You have seen for this case, I'll tell you, he had a high energy liver and a low energy kidney. तो ये ऐसा shift हो गया था. So by energy balancing and by the structural AP techniques, ये सीधा हो गया. इसका तो I have already told you how this is helping. So when the body is showing pain, it is an alarm that you need to see your physical, your emotional, your nutritional aspect. It's not just physical X-ray MRI में आ गया बस वो है. So it's never like that. I'll give one example for this also. Okay, so one lady had come to me yesterday and she was previously fell down. She had listhesis grade 1. She was operated, one screw, cementing, everything done 15 years ago. And she was little better, thoda bahut low back pain, but that back was sensitized. Now what happened, since last 1 month, her pain again shooted up. Okay, she had all pain, pura radiating down, burning, everything. Okay, then I had a physical examination. She was a hypothyroidism, so metabolically disturbed. Then like her face everywhere, I could see a lot of holding. Okay, she was thrice C-section scar, and the fourth one is the lumbar spine operated scar. So ye 4 scar, all muscles went down, but she was 15 years se chal raha tha. Then what happened, 1 month ago, her husband fell down. He had a fracture, which is non-uniting, oozing, and all those things. So that added up to her story. So that was her pain story. So now from today, I'll be working on her relaxation, on her pain story. And I think I'll be able to I'll be able to help her to come out of that pain. Okay, so pain, when it is persisting, okay, and when it is disabling, yes, it will have emotional component. Yes, so because there is central sensitization hai. So because वो peripheral nociception was coming many a times, बहुत हो गया. So this, which is a non-specific low back pain, it has a subconscious response, okay, and the subconscious response is in the form of muscle guarding or muscle guarding hai, and over that we are adding to more and more guarding to that patient. Already wo high pelvis mein hai, diaphragm high hai, already the patient is into guarding. So we need to plan our treatment according to the patient who is presenting to us. Ideal protocol, I'll tell you, no one is there. Ideal patient ही नहीं है. Every patient has a different attitude, a different presentation, a different story. So when we went into that, yes, it will help us to come out of that pain. So I'm definitely we can give a hope to the patient so that he will change. And yeah, that's it. Thank you so much. And I would like to thank all my teachers. Okay, these are few references. So basically, I want to thank Cheryl ma'am, Vardhaman sir. Because of them, I am here doing all these things. I'm very thankful to my Curtin University teachers, Peter O'Sullivan, then Toby and Kim. And also I'm very thankful to all my graduate teachers who have given me the base. So on the base, Ramteke sir, Umanjali ma'am. So because of them, I could do so much in my career. Thank you so much, everyone. Thank you.
Thanks a lot for this wonderful webinar.
Thank you. Thank you.
Thank you,
Thank you,
ma'am,
thank
for the wonderful webinar. Any questions from the audience? Ma'am, there is one question. Like after how many days after C-section can we start for the mobilization of the scar?
Yeah, so minimum, it's like the healing takes around 6 weeks, 1.5 month. So like we can start by mobilizing around around the scar. Around the scar, fascia mobilization that we can start once those stitches are removed. That stitches they remove after almost 9 or 10 days or sometime 11 days. So we can start mobilizing around the scar. But after it is healed properly, then we have to go into the depth. Till that time, what we can do, we can work on the pelvic floor, we can work on the diaphragm, we can work on the activation of the muscles. Okay, so all those to begin with we can work, but actual healing takes almost 6 weeks. So after that, yes.
Okay, ma'am, there is one more question.
Yeah.
What's the physiology behind dehydration technique when you pull the hair and the hand dropped?
Yeah, so that is like this is physiological technique or kinesiology technique. We can see the hydration through our tongue. We can ask the patient to take out the tongue the way the physician do, or sometimes we can just pull the this thing what we can say, the skin. So from that, these are all the detailed techniques, kinesiology techniques.
Okay, thank you, ma'am. One more question from my side. Like for this physiology part, applied physiology, can you just suggest us any of the things from where we can do this?
Yeah, so
Course?
level 1, Vardhaman sir is taking at this moment, and you need to cover that level. So if that you are done, then the rest of the levels you can definitely go ahead. So Cheryl ma'am, she comes from Australia, and then like it is 15 days workshop, so we need to stay there. And I'll tell you, like I have changed myself totally because I was stressed and I had a lot of anxiety. And this 15 days, it's all for me, myself. I am like every day, every time what happened, we are doing for the patients only. पेशेंट के लिए ये मैं सीख लूं, वो सीख लूं, सब सीख लूं, पर खुद के लिए क्या? So this is like for you. Every day you will have 2 corrections, and every day you will be a total different person. So it's a awesome course, and we are learning it. We have done 4 levels, so we are learning it. International, it's accepted. It's a kinesiology course. So the international accreditation you will get after this, and it's a very good course.
Thank you, ma'am. There is one more question from the audience. Ma'am, which technique you used for fascia release and MFR and ISTM is effective in this?
Yeah, you can use all those techniques, but usually what happens, the feel which comes through our fingers, वो तुम्हारे eye strip में नहीं आता है. So we follow the anatomy trains. Don had come, Tomkinson from anatomy trains, and I had a opportunity to attain that course. And those techniques of fascia release I have shown, they are with courtesy to anatomy trains, and they are awesome. Like we can feel the melting of that fascia when we are doing. मैं तो बोलती हूँ मैनुअल थेरेपिस्ट, दे हैव यहाँ पे पूरी सेंसिटिविटी, दे हैव ऑल देयर आईज in their fingertips. So we come to know when we are doing it manually that the fascia is melting. We separate the septums differently at different levels. So that much amount of anatomical knowledge we need to have. And when it gets separated, you have seen that slide where for the low back pain, I was releasing the superficial back line, wo theek hai. But then through the ankle, I was taking care of the low back. I was releasing the superficial front line. So superficial front line was tight, was inactive, so it was affecting the superficial back line. So it's like always, it's a manual therapy approach which I go. You can go any type, but a manual therapy I prefer too much. Being a manual therapist.
Thank you, ma'am.
Thank you.
Thank you for joining the webinar. We
I would
appreciate.
like to thank Mayura because she had given this opportunity to me to present my clinical experience. Okay, I am a clinician 100% since 26 years I'm practicing. So I would like to thank her. She was my student long time ago, but now she's a teacher and she had given me this opportunity. So thank you, Mayura, if you are here.
Yes, ma'am. My pleasure, ma'am. It is always being a pleasure to hear you.
Yeah, thank you. So we need to have a complete look at the patient. ऐसा नहीं कि लो बैक है एक्सरे एमआरआई ही लेके बैठो. So I like at my clinic first I will assess because what happened we get bias. अरे वो डिस्क है वहां पे प्रेशर है इतना ल्यूमेन कम हो गया ये we get biased and then we are not able to reach to the pain story. So I never go through the papers. Okay, I first have a good evaluation all this biopsychosocial model. I go through that, and yes, at the end I will definitely to rule out the red flags. I have to go through the drug history. I have to go through the investigations just to rule out. Okay, so once we are rule out वो red flag वाला picture नहीं है तो then definitely ये central sensitization. और वैसे भी everyone is centrally sensitized. कुछ ना कुछ चालू रहता है. किसी को running nose, someone is having cough, someone is having breathlessness. So all these are stress at various levels. So stress management, and yes, I do a lot of DCAT techniques. Annamale sir has taught me. So those techniques, they are awesome. They just rewire your thinking. And जैसे reboot होता है अपना mobile. So वैसे with DCAT, you can reboot your neuronal connection. You can reduce your anxiety. So that's also like previously, as I have told that when we give relaxation, so that is a treatment of choice for me. That is relaxation.
So this stress factor, can we use it for students also, school-going students?
I'll tell you, वो तो कुछ भी नहीं. My son, he was 8 years old. Now he is since last 3 years I'm practicing. I'm into this. So I used to balance his energies. So we can do on anyone. After 5 years, वो समझ में आ जाता है ना. Because you have to do muscle testing, you have to follow certain commands. So जैसे बच्चा they are following, you can do any type. We can do like now I am working on immunity for someone. So it's like that.
Is it over, ma'am?
Yeah.
Yeah, wonderful session by Dr. Prajakta Nayyar, ma'am. And the Indian Association of Physiotherapists is the oldest and the largest association representing physiotherapists in India since 1955. The IAP digital media team consists of a group of physios who handle Zoom platform, webinar live streaming, and IAP profiles on social media platforms, Facebook, Instagram, Twitter, LinkedIn, YouTube. Follow IAP profiles on these social media to receive notification for our events such as webinars, workshops, CMEs, conferences, health camps, blood donations drive, and to know about recent updates on physiotherapy. Subscribe to IAP YouTube channel for notification of our live webinars. In playlist section of this channel, webinars are segregated into various folders on topics like orthopedics, neurology, sports and fitness, pediatrics, cardiopulmonary, women's health, research, cancer, rehab, etc. for easy access. The social media links were shared in the chat during that session, this session. That means you will get a lot of knowledge from this IAP India YouTube channel. You please subscribe this channel. And thanks for this webinar. Thank you very much from my side.
Thank you. Thank you for joining the webinar. We appreciate your participation and hope you found the session informative. We are grateful to have Dr. Prajakta Nayyar ma'am to share her insights on holistic approach towards low back pain. The session was innovative. She has shared an open, fresh avenue for understanding the topic well. We truly appreciate your time and effort. Thank you once again, ma'am, for your valuable input, and thank you for the audience for watching this webinar. Thank you, ma'am.